childhood vaccines as a major victory for parents and religious rights. The order reduces the number of vaccines recommended for children under federal guidelines, but top medical groups are pushing back, calling the move disheartening and dangerous. CBS News correspondent Bradley Blackburn breaks it down.
President Trump's new executive order reverses decades of childhood vaccination guidelines.
Vaccinations for hepatitis B, COVID-19, and influenza, among others, are no longer recommended for all children.
The order recommends reducing the number of childhood vaccines from 18 to 11, and it advises states to separate the measles, mumps, and rubella vaccine into 3 shots to be given in separate visits when possible.
Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist.
But in research conducted for decades across multiple countries and on more than 5 million children, there's no evidence the existing childhood vaccine schedule poses long-term risk to children's health nor increased risk for autism.
I'm not sure that there is anything that has been as thoroughly looked at as this question about whether or not there is a link between autism and vaccines. And the answer is unequivocally no.
The American Academy of Pediatrics called the order dangerous, while some pediatricians warn splitting up the shots places new hardship on families.
We would wind up starting to see drops in vaccine coverage for families who can't afford to keep coming in.
It is the states, not the federal government, that set school immunization requirements. The new executive order comes as the U.S. faces the worst measles outbreak in more than 3 decades. Bradley Blackburn, CBS News, New York.
President Trump yesterday acknowledged that the order issues recommendations, not mandates, adding that parents, of course, can still choose what shots they give their children.